Hi, good evening. This is Dr. Parijat Kumar, Director of International Sports and Orthopedic Manual Therapy. I hope you enjoyed our thoracic spine and ribs assessment as well as treatment virtual lab. Welcome to our today's thoracic spine and ribs treatment post-lab quiz answers. I hope you enjoyed the quiz and successfully scored the passing score. So let's get on to the questions and answers for our thoracic spine and rib post-lab quiz. The first question was, what kind of palpatory feel would you get with the anterior palpation of chondrosternal joint with the posterior subluxation of the rib? So when your ribs are posteriorly subluxating, there will be an empty can palpatory feeling. So you need to know your end feel when you are doing the palpation. That's very important. So the correct answer is number 1, empty feeling would be there with the palpation. Next question was, what would be the direction of the force with supine third rib separation mobilization? So when you are mobilizing the ribs, you kind of do some separation mobilization, and the direction of the force in supine would be actually in the caudal direction, which is down. Yeah, so it will be like caudal down direction. Next question, what should be the hand position of the patient with posterior translation of rib correction muscle energy technique? So when you're correcting the rib with the muscle energy technique, the hand position would be over the sternum for posterior translation. Alright, so the second option is the correct option. Next question, which was kind of a same question, but this was regarding the anterior translation. So what would be the hand position of the patient with anterior translation for the rib correction muscle energy technique? And on this one, it will be lateral to the chondral joint. So which is number 1 option, lateral to the chondral joint is the correct answer. These are all the treatment techniques that you should be knowing where your hand positions and your direction of force are. Okay. Next question is, what is the direction of force for the first rib mobilization or manipulation? And we do this first and second rib manipulation and mobilization a lot because these are very much involved when you see your white collar or corporate or postural issues. So first and second rib is very much involved when you have neck pain, back pain or shoulder impingement. So very basic and very common, and a simple answer to this was you mobilize or manipulate the first rib to the ipsilateral hip. So if I'm mobilizing my left first rib, so I have to push it towards my right contralateral hip. So it was a contralateral hip, so opposite hip. All right. So the correct answer is second option, contralateral hip. Now when you do, the next question was the direction of force with the second rib manipulation. So when you're working on the second rib manipulation or mobilization, you work on the ipsilateral hip, which is the same side, ipsilateral hip. But when you're working on the first rib, it goes towards the contralateral opposite hip. The next question was, it's a case study that the patient is a 42-year-old male presenting with a right shoulder pain and decreased range of motion. The patient can show increased range of motion like 170 degree when they are supine, but flexion in sitting is restricted to like 80 degrees. What would you treat first? If that is the case, you are definitely going to treat the second to fourth ribs because it could be a dysfunction, and that's why when you lie down, the rib dysfunction is relaxed. You sit, there's a hypertonicity of the muscle, and there could be a second and fourth rib dysfunction. So that's why the elevation range can be restricted in sitting. Next question, what are the muscles that you target with second rib laterally flexed muscle energy technique? A very simple question again, it's a very common technique that we do. It is scalenus anterior and scalene posterior. So anterior and posterior of scalenes are generally targeted when we are doing this second rib lateral flexed muscle energy technique. All right. The next question, what part of the body will receive sympathetic down regulation with T4, T5 thoracic manipulation? If you remember our sympathetic regulation of the segments, so T4 and T5 are generally involved for upper extremity, and the correct answer would be upper extremity. If it is a lower extremity, then it will include T7, T8 and below. Our next question was, which part of the body will receive the sympathetic downregulation with T1 and T2 thoracic manipulation? Yes. So when you want to work on the symptoms of your head, you can actually work on your T1 and T2 to sympathetically downregulate the nerve system. All right. Next, again, it was a pelvis question, and it's a bonus question, guys. Patient with, and it's a very simple answer if you really know your pelvis diagnosis and treatment. So patient is a 37-year-old female presenting with a right hip pain with restricted right hip range of motion. The findings are sitting flexion test is positive on the right, standing flexion test is positive on the right, supine to sit is short to long, which means that the pelvis can be posteriorly rotated, the innominate posterior rotation. The sacral base is deep on the right and the ila is prominent. It's a very simple diagnosis, guys. So on the right, there will be a unilateral sacral flexion. So when you have a posterior innominate rotation, there is sacral flexion. And so this 37-year-old female will be having a unilateral sacral flexion. So that is the third answer, third option. Another bonus question from our last thoracic spine assessment is that which of the following dysfunction would you suspect if the patient is having one side unilateral achy pain with some restriction in thoracic rotation? So when there is rotational deficit, you need to know there could be a facet joint involvement, because that is what the facet joints are meant for. And thoracic spine has the most range of motion in rotation and is a unilateral pain. So there could be a thoracic spine facet dysfunction. All right, that is the third option. So guys, that was all the questions and the answers. I hope that was not too tough this time, but that was very important and evidence-based. You need to know your direction, you need to know your palpation structure, and that's how you can treat your patients. We would welcome your suggestions and feedback. And one important information that we would like to give you is that the International Sports and Orthopedic Manual Therapy is organizing our first online certification course, which will be on pelvis and sacroiliac dysfunction, because many things are related from your pelvis and sacroiliac. We would be doing this on October 10th and 11th, 5 p.m. to 8 p.m. Indian Standard Time. You're welcome to register for it. This will have a little bit of fees. And that's why we will be giving you all the written material, the video access to our website for this particular pelvic course, and the certification of attendance. So this is a certification course by ISOMT on pelvis and sacroiliac dysfunction for an efficient diagnosis as well as treatment. So please register, and I hope you learn an evidence-based knowledge. Once again, this is Dr. Parijat Kumar, Director of International Sports and Orthopedic Manual Therapy. Keep learning and keep improving lives. Take care.